In the previous episode,
it's probably considered the Academy Awards of workplace wellness and health and well-being programs out there because we really require data to prove the programs worked.
Yeah, wonderful. And we're thrilled that in our next episode in this series, we're going to have a representative from Union Bank and Trust who was recently recognized as an honorable mention for the Everett Koop National Health Award.
Welcome to the Behavior Change Architect Podcast, a conversation about innovative and evidence-based behavior change strategies designed to increase well-being. Tune in to listen to thought leaders, industry experts, and innovative scientists discuss hot-button topics surrounding specific behaviors, design, and communication strategies. Host Dr. Kerry Evers takes you on a journey to change the discussion, change perspectives, and ultimately help you change behavior for your clients, populations, and perhaps even yourself.
Welcome back to the third episode in our series on workplace well-being, and I, for one, cannot wait for today's conversation. As part of this series, we've discussed trend spotting in the field with Karen Mosley of Hero, the current state of the research with Dr. Ron Getzel, and today we're going to chat about what it takes to implement a workplace well-being program. Now, we know that while over 80% of large employers and over 50% of small employers offer health and wellness programs, not all of them are successful in outcomes or engagement. But today, we're going to be talking with someone who has implemented a program that has not only been recognized both within the state of Nebraska, but also nationwide for outcomes, innovation, and leadership. Sam Dolezal is the wellness advocate at Union Bank and Trust, or UBT for short, and leads the UBTWell program. Welcome, Sam. Thank you so much for being here.
Thank you for having me on. I'm looking forward to today's conversation as well.
Well, I'm really excited to hear about the details of some of the work that you've done. I've read a lot about your programs, but I know there's so many aspects that don't necessarily make it into the press releases or the presentations. But before we get into that, why don't you let us know about your current role at Union Bank and Trust?
So at Union Bank and Trust, my role comprises of quite a few different things. First off, it's engagement, participation engagement, and this looks like personal training, fitness classes, connections to our EAP, helping run our biometric screening process that partners with our health insurance. And I think most importantly is being that cheerleader for folks, being the person to let them know that they can do this. It is possible. It takes a little bit of hard work and some time, but many of our folks appreciate that support and the overall encouragement that they are able to find within both Union Bank and within me. So there's lots of other things I do as well. But again, we have a lot to get done today, so I want to make sure we cover everything.
Sure. So I'm curious, what is your background and how did you come to be in this position?
My background is very much a winding path. I went to school at Nebraska Wesleyan University, got a background in exercise science and sport management. Following that, I wasn't sure exactly what I wanted to do, so I was fortunate enough to get a NCAA postgraduate scholarship, which allowed me to continue into graduate school. I received a higher education and student affairs master. Following that, then I decided I really like school. Went to get my master's of exercise science, and then ultimately ended up with a doctorate in healthcare education and leadership, which has all served me quite well. When we talk about workplace well-being and helping individuals, much of it boils down to how do individuals learn? How are they able to take information, process it, and apply it? And so going back to my higher education, health education background, it's really, I know it, but how can I help others learn it, know it, apply it? My path is not straight. I was also a track coach. I was the nurse's aide. There were lots of other things that played into what I do today.
Wow, that's amazing. And it's so true that learning is such a big part of kind of all of the programs that we're implementing. And I just recently came across a quote from you that, if you don't mind, I'd like to share. This said that over the last year, Union Bank employees have continued on their good health journeys, working out both virtually and in person, focusing on stress, gratitude, and mindfulness, receiving customized nutrition counseling, participating in local community walks and runs, kicking tobacco with the help of cessation support, and participating in countless other initiatives that have, in turn, been reflected in UBTWell's success. And I was blown away by that quote because that is quite a list of different types of programs. So can you tell us a bit about UBTWell and how it's implemented? What behaviors are you working on and what programs do you have?
So I'd like to start from the participant's perspective, kind of a life cycle of when they start with Union Bank, and then as they're spending more time with us, what are some of the things that are available to them? So when we have somebody who joins our team at Union Bank, they have access to a whole host of benefits. One of them specifically being our Wellness Reimbursement account. Associates get $250 every year to spend on a variety of approved items. This can be your standard gym membership. This can be a weight loss membership, nutrition counseling. But in the last few years, we've expanded it to be a more holistic program. An example of that is if you want to download the premium version of the Calm app, we will reimburse you for it. If you want to do financial counseling or take a budgeting 101 class, we will reimburse you for it. We've offered all of these things as a way to encourage folks to make the best choice for themselves, which means that it may not be a gym membership. It may be, I really need to focus on my credit card debt. Or, hey, I have a kiddo going to college soon. I would really like to be in a good place when they start. Again, everyone is so different, and given COVID now, people have stepped up to the plate and they're ready for change. And so how do we support that change? That's one of the things that we've added in the last year or so. Other things when folks join our team that they'll see is we have 2 on-site fitness facilities. We have healthy catered lunches 4 days a week that are free to our associates. We also encourage walking meetings. We have tobacco-free campuses. That list goes on and on. As they spend more time with us, then they will start to notice things such as more of those informal patterns, such as we have quite a few folks who get up throughout the day and go walk. They go outside, or when it gets chilly here in Nebraska, they find a treadmill. Again, those healthy lunches as well. I've had so many folks tell me, Sam, I eat more salads at work than anywhere else, which I find a really good thing. But I think overall, as they spend more and more time with us, they start to feel the support. They start to feel that this is more than me as a professional. This is me as a person. And Union Bank and Trust wants to support both. They want to watch me grow and develop and be the best that I can be. From a administration standpoint, applying these things is really about team and collaboration. And so when we talk about that Wellness Reimbursement account, we actually have an in-house group known as Omnify. They run our Wellness Reimbursement account along with our HSAs and FSAs. And so it's all in one platform for the participants. They don't have another login. They're able to log in, see their HSA, FSA, and the Wellness Reimbursement account, which is super. When we talk about our lunches, we have 2 vendors who come in. They do a fabulous job for us. They run a lot of it. Our fitness facilities, I can't say enough good things about our facilities team who make sure that everything's working properly. I have everything that I need. And those days when I need an Allen wrench, they show up with an Allen wrench for me. So when it comes to the actual administration part, we have a whole host of folks behind us, making sure things run smoothly for our participants.
So it really sounds like there's a culture of wellness and well-being within the entire Union Bank and Trust leadership and all of the employees.
At Union Bank and Trust, we are more than money is the way that I would like to say that. We are about our customers. We are about our people. We are about professional development and personal development. And wellness is one of those where we know that when folks come to work, that they want to be here and they're supported in whatever direction they want to go. And so, for example, I have one individual who went through a major weight loss transformation and found the courage to tell his supervisor, I want to be a manager. I want to lead people. And now I have the confidence to do it. And he is now a manager. And he is saying that I couldn't have done it without losing weight and finding the confidence to do that. And so we're seeing
that's
that
wonderful.
Yeah, I love that example, but that's the told story. There are so many untold stories like that where folks are finding that support and encouragement and saying, it's not a matter of if I can do it, it's a matter of when I can do it. When are you ready to step up to the plate? We'll be here to support you, whether it is that professional development or that personal development.
That's amazing. And, I was reading up on several different things, and the UBTWell program has received numerous awards. But one of the ones that really stood out to me was the Wellbeing Partners Torchbearer Award, which, if I'm understanding correctly, is presented to programs that are leading the way in cultural well-being and innovation. So how do you stay on top of that innovation when you're, rolling out new things or taking a look at your programs? Where do you get your inspiration?
When we talk about inspiration, a lot of it comes internally. I ask folks, what would you like to see? What is most helpful to you? One of the examples that I like to look at is smoking. And a lot of times we get into this, smokers, they don't want to quit per se. And I found that that's not necessarily the case. I have a lot of smokers who do want to quit, but they have spouses who smoke. Their friends smoke. I say smoking is a social sport. How can we help you develop a new social circle or a socially acceptable circle where you not smoking is okay? Because a lot of them say, I went to this football game and at halftime we all go out and smoke in the parking lot because we can't smoke in the stadium, but those are all my friends. I don't want to sit in the stadium alone. And so it's less about smoking and it's more about that emotional intelligence and social relationships and support, as well as confidence. And so instead of focusing on that smoking cessation, I focus on, okay, who else could you sit with? Or what could you say? How can we help you go into those situations prepared for whatever will happen? Because again, 75% of my smokers want to quit. It's just a matter of, do I feel supported? Because this is going to be a journey, to say the very least, but what can we do to help you prepare for that journey? Because ultimately they're the ones who are going to have to walk that path. So I see a lot of those things happen.
That's great. So if you could add anything to your program, or if there was a focus that you don't currently have, what would be your passion? What would you want to add to it?
That's a really good question. There are a lot of things I would want to add. I think the number one thing would be that emotional intelligence, social boundaries, social relationships, because understanding the world that we live in, the individuals that we interact with, play a major role on how we function and live. For example, if you have a spouse who doesn't exercise, what is the likelihood that you are going to exercise? But again, that's a process. That's helping folks realize where they're at, where they can go, how to support themselves. Because when we talk about things such as, hey, I don't have time to exercise, I ask them, how many minutes a week do you think you spend on Facebook? Most of the time it's 20 to 30 minutes a day. And I said, well, there's your 20 to 30 minutes of exercise. And they're like, oh, I didn't think of it that way. But that self-reflection, boundaries, emotional intelligence piece, if we could do more on that and engage folks in those areas, I think we would find more success, because then they would be better equipped to help themselves.
Yeah, that would be a amazing addition. And please let us know if you do, because I'd love to hear more about that. Ron Getzel mentioned in our last episode that your program was recently honored by the Everett Koop National Health Award. And I believe this isn't the first time you've been honored with that. Is that true?
That is true. We, 2 years running, have been honorable mention for that award, which is an outstanding honor for us as an organization and for our participants, who are the ones who ultimately, are making these changes, and this program is running is because of them.
Yeah, that's an amazing accomplishment. And I know that award is a bit different than others because it's very focused on data-driven results and health outcomes and documenting the results, both in terms of health improvement as well as economic impact. So can you tell us a little bit about the experience of applying for that and maybe what some of the impacts you have seen on the UBT community of your programs?
The application process was one of reflection for us to realize that what we're doing is in some ways very unique, but also very tailored to our organization. Because you don't really realize when these things are happening around you that, hey, we're doing all of these things. Like they're actually happening. They're not just talking the talk. We're walking the walk on these, which in some ways helped us have a better understanding of where we had adequate support for individuals and where maybe we were lacking, and also open the door to, okay, where can we go next? What should be our next steps? Because we always want to be looking forward to where do we want to go, while also saying, okay, this is what has worked. How can we continue to have this work for us? So the application process was really one of reflection for us. Ultimately, when we looked at it, our program as a whole, we were doing a really solid job holistically, but ultimately the outcomes and data-driven piece was where we were lacking a little bit. And with my background, I was able to implement more of those qualitative kind of data researchy type ways to measure, is this working or not? So we did more surveys. We implemented more participant feedback. What are your thoughts? Did you feel like this was supporting you? Was it not? How could we change it? As well as then working to get more of our community involved. And okay, if you're not at work, what are you doing at home? What is helping you be healthy, or what is, kind of straying you away from your goals? So that was our application kind of experience.
Interesting. So what do you think is the biggest impact on the UBT community?
When we talk internally about like our actually family of Union Bank and Trust folks, it's really been the how do we get family involved? How do we help spread the word that this is available to folks? Because when we talk about community involvement, it's getting our UBT family out into the community and utilizing the available resources. So for example, those gym memberships, letting people know we have 50 plus gyms, fitness facilities available in the Lincoln area, and you have your Wellness Reimbursement account to pay for part of those memberships. Have you joined? What options have you looked at? One example that comes immediately to mind is there is a medical fitness facility in Lincoln that has a warm water track. And so it's warmer than usual pool water that has a walking track built into it, which I know for some of my folks would be like, that's an awesome, super awesome offering for them. And again, the Wellness Reimbursement account, you can have some of that membership paid for, and encouraging folks to get out and take their kids with them, take their spouse with them, take your BFF from down the road with you, and help them become engaged as well in these healthier behaviors. Because I mentioned earlier, those social boundaries, relationships, emotional intelligence, who we surround ourselves with impacts our health and wellness. And if we can support the whole circle, we know that our associates will find more support and are more likely to reach their goals.
That's amazing. Now, one thing I forgot to ask is how many people are at UBT that could benefit from your systems and programs?
So Union Bank is made up of right around 1,000 associates. We span over 30 locations in 2 states, which can sometimes make things really interesting. We do have extremely high engagement. More than 90% of eligible folks participate in the programs. On average, we say that if we have 1,000 associates and we want each to have 5 touch points, so 5 experiences with wellness. So we need 5,000 touch points for the year. These touch points include wellness challenges, flu shots, the wellness reimbursement account claims that go through, all of these things saying, hey, we want everyone to be touched by us on average at least 5 times. And last year, our average was 5.6. We want to be there with you along your journey, whether it's going super well or whether you're saying, hey, I'm not sure if I can do this or if this is the path for me. And so we've kind of implemented that level of evaluation to make sure that we are reaching our folks regularly. when we talk about kind of the behind the scenes, okay, you had mentioned earlier, who is running these programs? It is, again, a whole host of people. We have human resources, facilities, information technology, our external vendors, like those who do lunches or Omnify, for example. I would say we regularly have somewhere between 15 to 25 different individuals involved with wellness at any given time.
Wow. So it really does seem like it's a buy-in from the entire UBT community that has helped to drive some of the success that you've had.
We could not have been this successful without the support of other individuals. And again, our participants. One example of programming that we just did was we do on-site flu shots, and we did almost 300 on-site, which great numbers, great turnout. But I kind of did some looking to figure out, okay, how many people did it take to pull this off? And it took about 13 individuals between facilities, information technology, myself, our external vendors, to actually get those 300 shots administered. And so it just, again, everything's kind of that way. Our wellness reimbursement account, we have a team of 13 at Omnify who make sure that participants get their questions answered and their claims are reimbursed properly, that everything is running super smoothly. So I'm super fortunate to have that team behind me. Again, I also need that support as well to make sure all these things run properly. So huge shout out to them.
So I'm sure since COVID started, since the start of the pandemic, you've had to shift gears a little bit, and I'm sure there's been challenges. Is there anything that you've changed that you think you'll continue doing now that it was a kind of a bright spot from the pandemic?
One of the things that we've changed is we've made more virtual events, which I think was on the table, but the importance of it moved up. Again, when we have 30 locations across 2 states, it's how do we reach everyone in a similar capacity? Because we can't say that it's going to be the same, but how can we give folks what they need? And when we move to a much more digital / virtual format, those folks in some ways were put on the same playing level because we were all virtual. When most of our Union Bank and Trust team was working from home for some period of time, and most of our fitness classes moved online, we started a virtual meditation that anyone could call in and join. But then again, it made the playing field very even. And many of those components have transitioned forward with us because we've come to found that we can do this. This is possible if we do X, Y, Z. Again, the pandemic kind of pushed the fast forward button on some of these things, but I think it was a good thing for us to get those programs up and running in that virtual format.
Yeah, I try to talk with people about where can we find some of those bright spots coming out of the pandemic, and we've heard from others that it just really has accelerated being able to be more inclusive in many ways. So I'm thrilled to be able to hear that. So anything else you'd like to share that's unique about your program or challenges that you've had to face that you'd love to share how you overcame them with our listeners?
I think talking to folks who are, looking at that change, how do we move forward specifically in workplace well-being, is try it out, trial and error. Many of the things we did were trial and error. Coming from my background, again, I looked at the research. I looked at what are other people doing. I made a lot of phone calls to folks. Have you done this? Have you tried this? And in doing that, helped to build a case for whether or not we should make these changes. Should we do this? One of the big changes we made was we moved our biometric screening from an on-site screening to a provider visit. And so individuals, in order to complete their biometric screening, they needed to see a provider. So that could be a MD, a DO, a PA. They had multiple options. But when we made that change, we made that before the pandemic started. And fortunately we did, because we wouldn't have been able to have those on-site screenings in 2020. But we noticed that our number of annual exams went up. We noticed that folks were calling us saying, hey, I didn't realize that my glucose was so high. Or, hey, I didn't realize that I, needed to have a mammogram when I'm X age. And it really started those conversations that we ultimately wanted to encourage. But we were the first ones in our area to make that change, that shift at such a kind of major level for individuals who were used to doing them on site. But in calling other companies and reaching out and working with our external vendor, is this possible? The answer is it is, but there isn't anyone who's done it in the capacity that you're trying to do it. But that shift for us, for our participants, was monumental because it did change the game for many of our participants when it talks about their health. Folks who didn't have a primary care provider before now do. And they're letting us know that, hey, I didn't realize that if I did XYZ, I would be better off in 10 years. We're like, yeah, this is really why we made the switch was for you, which drives most of our decisions is how is this going to help our participants? How is this going to help our Union Bank and Trust family? And so kind of talking to those out there who are looking to make those changes, do your research, reach out, again, get all your ducks in a row, and then make it happen.
Such great advice from someone who's been there and has been doing things successfully. And we started off this series talking with Karen Mosley at Hero, and we talked a lot about trend spotting and kind of seeing what's coming. And it sounds like, Sam, you have been doing that by really focusing on what the needs of your population and your team members at UBT need. And so that is such great news to hear, and just congratulations on all of your success and everything you're doing. Thank you so much for being here with us today. We're thrilled to be able to hear about everything that you're doing, and I'm sure the listeners to this podcast have learned a lot. We thank you for your time, and with that, we'll just close out unless you have anything else to add.
I do not. Thank you for having me, and glad to share our experience with the Koop Award, as well as all the great things that are happening at Union Bank.
Great. Thank you so much, Sam. And thank you to all of our listeners. We will be back in about a month with our next series, and we look forward to talking with you then.
Thank you for listening to the Behavior Change Architect podcast. To continue the conversation, visit our website at www.behaviorchangearchitectpodcast.com, where you can sign up for our newsletter or follow us on your favorite podcast platform.